Gail is now 2 days post-op from her Jiffy Knee, and she's here in therapy, and she's going to show us how well she's moving and tell us how she's doing. What has been your experience the first 2 days?
The pain is very minimal. The only thing I have is swelling, and that's pretty, to be expected.
Have you had to take any narcotic pain medication?
No.
No, just Tylenol?
Yeah, and
Ibuprofen?
Yes.
Excellent. Can you show us how well you're moving your knee today?
No, I keep that one straight.
Okay. So your range of motion, and Kyle your therapist will tell us how he thinks you're doing 2 days after.
Yeah, so this is her first evaluation. She's 0 to 95 degrees active range of motion. No quad lag with the straight leg raise. She walked in without any limp at all, and seems very good.
So again, her range of motion is 0 to 95. She has good quad function, and she's walking very well. Would you mind showing us to walk out here in therapy?
Sure. I'll put my other shoe on. Yeah, it's kind of easier if I step into it. Those are those sliders things.
And I'll get this out of your way. What you step down? If you wouldn't mind walking out in the hall for us.
Nope.
And then walk down the track this way to the right.
Stop doing it backwards. Stop myself. Not used to the walkers.
So what would you like to tell people that are thinking about having a knee replacement?
My experience has been relatively great. No pain coming out of the surgery, and second day still none. Just the tightness from the swelling. That's my only issue so far.
And how did you hear about the Jiffy Knee?
Coming into your office, but my daughter recommended you.
Okay.
So.
Well, I think you're doing fantastic just 2 days after surgery, so keep it up.
Okay, thank you.
All right, thank you.